A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Mary Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Hello, lovely to see you. Thank you so much for joining us. And I'm really pleased to be able to welcome back Dr. Anthony DePontes. Welcome, Anthony. How are you?
Good. Yeah, it's wonderful, Mary. It's the start of the year. I'm raring to go. Not exhausted yet. Still got lots of rumor in me.
And you've got a lot going on, I hear, as well. You've got a lot planned for this year.
Yeah, this we've been doing this for maybe 3-4 years, and it seems like everything is coming together. You know, we've built the communities, and we know how to run the groups and to interact with the patients, and we're starting to get a, dare I say, like a following or lots of referrals happening. So the wheel is turning, and it's good. So now we're doing this.
Excellent. So let's just remind everybody, shall we? Because you are not only a homeopath, you're a functional medicine doctor, you're an acupuncturist, and you specialize in thyroid autoimmunity.
Absolutely right.
And just remind me what your Facebook community is called.
The Facebook group is Homeopathy and Functional Medicine for Chronic Disease and Thyroid Autoimmunity.
Okay, excellent. We will put a link down below so that people can go and find your community. What are you? I mean, you're building up a really nice community here. How are you helping people with thyroid autoimmunity?
So I put this group up and I started developing it in a way that was specific to my manner of practicing, okay? And I put a lot of emphasis on education. And the reason for that is when you look at thyroid autoimmunity and you look at the traditional or the medical model of treating thyroid autoimmunity, it's like coming to a crossroads and everything splits, okay? But the problem is that most people are stuck in the medical model, and to the untrained eye, it makes perfect sense. You've got a low thyroid function. Oh, okay, we're just going to supplement it, and we're going to bring it up, and then presto, your symptoms should be gone. Okay, that's not always the case. But if you're a homeopath or you've got some insight into how healing happens, you're not really healing anything. You might be managing something at best. There's no healing taking place. So what you find is people have had this diagnosis, and 15, 20 years down the line, they've still got their diagnosis. They're still on the supplementation, and they're still going up and down with good days, bad days. And so we've seen no cure. So when I started this group, now how am I going to tell them that they've got to throw the baby out with the bathwater, and we're going to run a new bath. Okay.
Yeah.
So the new concept is using homeopathy, and we are running away from just topping up the thyroid levels and working towards root cause, figuring out the root cause, and often in any any autoimmunity condition, that root cause is like hidden away down the lane, to the left, in the bushes. It's hidden. So it can take us some time to figure it out. But once we get that, and once we pull that root out, the everything starts to fall open. And the patient, and it's all about the patient, is then able to see, oh, that's where I went wrong, or that's what I need to change. And then they start changing. Obviously, and I know I'm biased, I'm a homeopath, I say the homeopathic remedy is the thing that changes everything or pushes them over the edge to make that change. And when we do that, we don't just do the homeopathy. Yes, I'm going to be looking at the functional medicine aspect. Often there are physical issues that come in that you might need a supplementation for, or you need to do a lab test or so. So we throw that in there as well. But when I'm looking at autoimmunity, nothing trumps homeopathy. Autoimmunity, if I can give it a basis, a trend, I'll say emotional suppression. Now, if you are knowing a lot about homeopathy or you're into the natural way of thinking, you'll know what I'm talking about. But basically, through your whole life, or for the 10 years that you've had this condition, you've swallowed all the time. You've suppressed your feelings and thoughts and actions, okay? And what that does is it confuses the body, or the body doesn't know how to process that, because every time it tries to process it and brings it up, you shove it down with, I'm bad if I do that, or, the physiology starts to go down. And then the knock-on is your thyroid is down. So now it's about retraining the patient to change the way they do that. That most homeopaths, let me put it this way, any good homeopath knows about that fully. That the challenge is getting that across to the patient. So this is why I started the group, and you'll see we're doing a membership now. It's to spotlight the education, to get them to, if you wake them up at 12 o'clock at night and you talk to them and you ask them, what is a healing crisis, or why do you get a healing crisis, or what do you do in a fever? All these basic factors that we look at from a homeopathic or a natural medicine perspective to move to healing, people know a little bit about it. But if I can teach you about it so that when I wake you up at 12 o'clock at night, you're like, I know that. It's like in your psyche, it's in your body. And when you have to make decisions about your own disease process, and you've got that grounding, it's so much easier to run through a healing crisis or run through an aggravation. Where if you don't have that, people are like, whoa, this is a bit scary. I'm just going to go and take some antibiotics, or I need to go to the hospital or something like that. Now, if you need to go to the hospital, you need to go to the hospital.
Yeah.
But when we're talking chronic disease, most of the time, you don't need to go to the hospital.
Yeah.
But people don't know that.
No,
Okay.
they don't.
They've been so conditioned
Yes.
to, whoa, this is serious. I'm feeling out of my depth. I must go
Yeah.
to the hospital.
Yeah.
And that is the right thing to do. But I'm trying to get them not to feel out of their depth by understanding, by education. And that's why I'm taking so much time on a patient to educate them. And it might only bear fruit in 3 months, 8 months, whatever it is, when we are treating them and they get a healing crisis. And then I say to them, don't worry, this is what I've been preparing you for. A real good typical example would be a mom with a young babe and they get a fever. That freaks most moms out. But if you've been preparing them and they can see and you can say, hey, it's happening, they are more akin to be able to trust you. Oh, yes, he's been teaching me about this. Okay. Or they talk to, these groups, they have lots of moms in them and they talk amongst each other. So they get very familiar with it.
Yeah.
Oh, yes, this happened to me, and I was able to manage it, and I didn't have to take the antibiotic or the antipyretic or whatever it was. And that's actually what I want to start happening. I want to get these people to become more independent with their health.
So it's all about really understanding their symptoms, isn't it? And learning to interpret their symptoms, and then
Yeah.
have something that they are confident in that allows them just to stop and think, and then consider everything that you've been talking about previously.
Absolutely. And so with these educational talks that you get in the membership, I'm slowly building on talk so that they've got a firm grounding. And when the pawpaw hits the fan, they like, no ways, I'm going through this. I'm getting my arsenicum, or I'm getting, whatever it is. And it's not just going to be on homeopathy. I'm going to combine the functional medicine. I'm going to combine whether it be herbal or whether it be, just using a castor oil pack, certain naturopathic principles as well. Or is it an acupuncture point that is going to help you to do ABC? All right. So getting these people in the group to be able to start implementing what they've learned. Okay. It's not going to not just a head knowledge, You got to apply it. You've got a practical exam, and that practical exam is called life when your babe goes and has diarrhea, or your babe goes and has got a fever, or whatever it is. Or even in yourself, if you've got the autoimmune condition.
So just understanding the differences, because you mentioned a membership there. So to start with, you've got a Facebook community where you go on and you can answer questions and help people when they ask a question. But now what you're doing is adding an extra dimension to this, because of course you are only one man at the end of the day, a good man, I admit, but you can only see so many patients one to one, can't you? So the opportunity of joining a membership, and because it's not just about taking one homeopathic remedy, is it? It's about actually teaching yourself new habits, teaching
Yeah.
yourself how to get this information so that you know it when the chips are down,
Yes.
and the trauma's happening, so that you are bringing a group of people together and giving them extra training effectively. Is that right?
That's 100% on the nail on the head. So, and for them to feel confident to do that. It's not just, oh, I did that course and I got that certificate for completing that course. I'm not worried about that. It's about being able to implement it. So when they are in the membership, we are going to be talking about, they'll get a video lecture. There will be live lectures. There will be quizzes. There will be Q&As. Okay, we were talking about fever, and but my baby, this and this happens. What should I do? I gave the belladonna and it didn't work, and then explain to them why, what, how. So basically, in essence, I'm making them comfortable. I'm making them feel confident. All
Yeah.
right. Um,
And the nice thing about this is being able to work with a group of people um, over a longer period of time. So they get to know you, they get to know each other, they get to trust, but all of the time they're learning, because everybody knows, everybody who has started getting into homeopathy, that once you start learning, it never stops, does it? There's always something else that you
yeah.
need to learn. But I think the most important thing that you are addressing here is helping people learn about themselves, about their bodies.
Yes, so that's one way to see it, and that is perfectly right. I'm wanting to make them independent. I want them to be able to make their own decisions. I want them to be able to be free, if you
Perfect.
hear what I'm saying. That doesn't say you will never go to hospital or you'll
Yeah.
never consult a doctor, but you want to be confident. I have it so often that patients are like, well, I don't know what to do. That doctor said this, that doctor said that. What do I do? If
Yeah.
you've got basic grounding, you can put one and one together and come to the conclusion yourself.
Yeah, and even just that, being able to take back responsibility of your own health means that it is your choice which doctor that
Yeah,
runs with your belief. So you're actually approaching a doctor in a different way, aren't you? You're asking their opinion rather than asking them to take charge of your body.
yes. Actually, it can be quite draining from being the doctor, and so many people expect you. Oh, well, you are managing my
Yeah,
diabetes, or you're managing my Crohn's, or whatever it is.
yeah,
That's a huge burden. Okay,
yeah.
so I think it'll work for both parties involved. And something that I've been realizing, let me say the last 6 to 9 months, is I'm breaking through with these patients and they're getting what I call emotional freedom. Now, if
Okay.
I say to you, Mrs. X, do you have emotional freedom? What do you mean? I make my own decisions. I've got my own emotions. Until you have broken through there, you don't actually know what that emotional freedom is. And it's when that vital force is so vital, you feel free to do whatever it is that you want. You don't like, oh, what's going to be the repercussion of this if I do that? Or you're not suppressing yourself over there. So your exposure and your ability to shine is able to come out more.
Mhm.
Um, and like I said, the last 9 months, I've just had patients popping into that zone partly because of the mega potency homeopathy. I believe it to be that. But I've set such a good foundation for them. They trust me now because we've had a few wobbles, and
Hmm.
it's as I've told them what happens there. You're going to have an aggravation. You're going to get better, and most people initially they're very scared. They don't believe it, but I'll try for another month, and then it's 6 months down the line, and then you have to remind them even. Can you
Yes.
remember 6 months ago you were not able to breathe or the asthma was like this? And
Yes.
wow, yes, you're right. And when last did you have an asthma attack? Oh, and they're going to count back. Oh, it's been so many months,
Yeah.
and then the penny starts to drop for them. So that's where I'm trying to go. And like you say, I'm able to to reach so many more people this way.
Yeah.
And it's like I'm holding each one of their hands. They feel safe and secure. If they've got questions, they can ask their questions. And because it's very easy, it's a monthly investment that you make. You're not tied in for years, but it is beneficial for you to stay there because if you have a wobble, I'm as far away as that to hold their hand. I think it's a good mix, a good match. But we'll see how the thing morphs out and what people want. They'll also have the opportunity to be able to say, hey, I want to know a bit more about diabetes, or how do we manage XYZ? And then I'm going to use the different modalities that are open to me to. We'll talk about the remedy. We'll talk about the supplement. They'll be able to order these things at a reduced price or a discounted price, and they can ask personal questions. So I think it's great, and I'm sure other things will pop up that I'll try and incorporate there.
Okay, so that's the beauty, isn't it? With it being new, it will develop as your community wants it to develop. It is
Yeah.
flexible, it is movable. Um,
Yeah.
but I mean, it sounds amazing. Who should be joining your membership? Who is it for?
So basically anyone can join, but then I think no, not anyone, because you've got to have a mindset. You've got to be open to natural health. And even if
Yes.
you open just a little bit, I will pry that little bit open to get you to, take a deep dive in and start to feel safe there. And so if you've got a bit of an inkling towards it, we will facilitate that and hopefully we'll turn you into a homeopathic student or just a mom that uses it for her family or someone who's able to turn their life around, stimulate that vital force and get healthy. So that's who it is. For the Facebook group, it's going to be anybody with an autoimmune condition. It doesn't just have to be thyroid.
Okay.
Because what I noticed running this thyroid group for about 2 years, yes, there's lots of autoimmune thyroiditis, but then they started to not just thyroid
Mhm.
because of, can I say that, this is a slither out of the entire group of people who have got disease. But out of the sliver that I deal with, yes, it was majority thyroid, but we started to see other ones popping up, whether it be rheumatoid arthritis or psoriasis or diabetes. All those are all autoimmune conditions. There's actually, in fact, more than 100 autoimmune conditions. So I want to widen the group, and that's why the name of the group has changed just from homeopathy and functional medicine for thyroid autoimmunity to include chronic disease and uh, all autoimmune conditions,
Mhm.
right? Because here's my rationale. I believe I've got a really good recipe for dealing with autoimmunity. Now, from a homeopathic perspective, you just got to um, focus in on the organ that is involved. So, for example, psoriasis is an autoimmune condition of the skin. Okay. So if I've got a good recipe for autoimmunity, we're going to treat that homeopathically or whichever process I'm looking through, but we're going to be focusing in on remedies for skin.
Of course.
Okay. If it's a liver autoimmunity, you've got an autoimmune hepatitis, you're going to be focusing in on remedies for the liver, the NUCs, the chelidonium. Yes, you will look for B vitamin deficiencies. You'll look for factors where there are viral components that are preventing the liver from healing. And maybe there's an alcoholic miasmic tendency. So you just turn the sight a little bit and focus it in on the different organ, and you change the remedy to be definitive for that organ. So I know I'm making it sound very easy. It's not that easy, but to explain it to you, that's what we're doing. For me, the most important aspect is looking at the autoimmune condition. And remember what I said that was? That's emotional suppression. So
Yes.
you see this big guy, and you know how you're thinking, well, he can't have emotional suppression. He's so big and strong and everything. But it is. It can be anything from not being able to say what he wants, or being afraid that someone's going to judge him, and he keeps that in, you know.
Yeah.
And when you're walking the road with the patient, and this not just with autoimmunity, you'll know, being a homeopath, when you walk the road with your patient for months to years, they really start to trust you, and they actually start to open up more than they would have opened up to a stranger on the street. So there's many benefits for walking the long road. As you and I know, Mary, we've been walking for, is it 4 years now?
5 years, Anthony, 5 years
5 years.
we've been doing
Okay.
this. And
So
yeah, and you're absolutely right in that, of course, with homeopathy, we're talking holistic. So there are all aspects, both of the health and of finding the homeopathic remedy, and of learning to recognize what the symptoms are actually telling you, and which organs need supporting, and where that is. So I can see that by teaching more about the whole body, about the symptoms, about collecting the information, about understanding what emotional suppression is and where do we go with that, then that's going to cover a whole range of chronic disease, isn't it?
yes. And something that I'm like really into now, and it's not a fad, but it is helping and supporting the person to be able to change. So many people struggle to change. Oh, it's scary, it's unknown. Okay. So this sounds weird. I will rather stay swimming in this pool of misery or hurt or anger because I know what it's like. Okay. There's a familiarity to it.
Mm.
I must step out into that pool over there. I don't know how cold it is or how warm it is or what is waiting for me there. So they stay in their disease process or their misery, or whatever it is. But if you can make them feel safe, and this is why the educational component,
Uh-huh.
then they can take the step into the next pool and heal.
And of course, many people are unaware of the social aspect of living life as we do, and what has been expected of us, what is expected of us, and how that actually suppresses what we want
Yes.
to be doing and how we want it to be doing. So you are opening a huge can of worms here, Anthony. I mean, we're going to be talking about every aspect of life, aren't we?
I love it, Mary. Bring it on. Bring it on.
It's really good. It's so lovely to see you doing this, and I think that this is the way that we want to go. I have got yeah. It just seems to me that we know that people are wanting to be curious. They're starting to show, well, what's this all about? Why is this coming up now? Why are more people thinking about, alternative, complementary, whatever it may be,
Mm,
different
mm.
ways of doing things? And we've been doing this for years, haven't we? And the people before us, the homeopaths before us, have been doing it for hundreds of years. So it's brilliant that we've got this ability now to reach so many people around the world and really start including them in this wonderful thing we call homeopathy.
Yeah, and you know why I think this is just like bursting out of the seams now? First of all, I just want to thank a few people. Thank you very much, COVID, for making people so aware of the alternatives
Yeah.
available to them. That was great. And all those homeopaths of past who set the foundation of what we're learning now, and we're just taking it to the nth degree and pulling the public, pulling people into this. And when they start understanding, Mary, it just makes sense. Okay. Um, you know, and this is not putting science down at all, but really, I'm going to say this: bullshit baffles brains. I tell you, I know what I'm talking about. And then I go into the doctor's office and he spins me a story. And because you've got these highfalutin words, I'm shocked, or I'm falling down and I'm not sure. And then I just go the way that he said because of the
Yeah.
fear.
Yeah.
So if I can teach the people in a warm, loving, supportive environment, there's no fear, they can start to make the choices. So that when they have to have the difficult conversation or they are in front of the doctor, they don't wobble and fall down. They can make decisions.
And what I am hearing, Anthony, that is really resonating with me is that it is time to find other people who believe as you believe, who are curious to finding an alternative way. Because, years back, it was very hard, wasn't it, to find other people that were on your, well, why is this? Why do I have to do this? Why does everybody do this? Why is this the only thing that you're offering me? What about everything else I could be doing? And now we're able to form communities. We're able to work together, and it's just
Yeah.
magnificent.
Yes, it's I say in the early days when qualified, you would walk that lonely road by yourself, and there were times where you think like, am I deluded? Is it just me? Like, how can everybody else be doing everything different? Am I wrong? But
Yeah.
as time went on, you start to know what you know. And like I said, thank you, Mr. COVID. You just made everything so easy, or much easier.
I think you're right. This has been wonderful. Thank you so much for doing everything that you do, Anthony, because it really is because not only people may not know that you also teach homeopaths as well, about this. You're doing so much for the world and for people's health generally. It's just a wonderful thing that you're offering. Thank you.
Oh, thank you, Mary. You make it sound so brilliant. Thank you.
We are very
Appreciate it.
privileged. Thank you very much for joining us today.
Right, hey. Bye.
Thank you so much, Anthony. It's so brilliant that you can come and explain so much with us. We're very, very grateful. Now, next week I will be talking to Dr. Varsha M. Karana, and Dr. Varsha will be talking about homeopathy and the underlying causes of infertility. What can we do with homeopathy? How much can we help? How much do we know it helps because we see the results? Let's find out more. If you know anybody that is going through the fertility down the fertility road at the moment, then this might really be of use for them. I look forward to seeing you then. Take care. I do hope you've enjoyed these episodes, and I do hope you can subscribe to our channels. Now, there are various ways for you to listen to our podcast or watch it on video on YouTube. So whether it's iTunes, Spotify, or YouTube, please do subscribe and please do leave us a review. If you leave us a review on these platforms, then more people will see our podcast. We just want more people to share the joy of homeopathy. It's a choice that everybody should know about. Please do everything you can to help us help more people.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.